Hi, everyone. Thanks so much for joining. I think we'll get started. We are still waiting for one of our speakers, but hopefully they will join shortly. So thank you so much for joining. Welcome to our webinar on pathways between climate change, water insecurity and mental health, organised by the Global Water Institute at the University of New South Wales in collaboration with the Resilience Centre Nairobi, Northwestern University and the London School of Hygiene and Tropical Medicine. It's so great to have so many of you joining us. This is really fantastic to see. My name is Claire Dooley. I'm an assistant professor at the London School of Hygiene and Tropical Medicine, and I will be the chair for today's session. Please note that this session will be recorded and we will be posting it online at a later date. We are very privileged to have 4 excellent speakers joining us today. Our speakers will provide insights from their own work in the areas of climate change, water insecurity and public health. They will bring us examples and case studies from Mexico, Kenya and the Caribbean. We will kick off the webinar by hearing from each of the speakers first. We will then have a roundtable discussion with our speakers. And finally, we will end the webinar with questions from our audience members. So please do put your questions in the Zoom Q&A box and please specify the speakers or the speaker that your question is for. And we will do our very best to address the questions at the latter part of this webinar. So our first speaker is Pablo Gaitan Rossi. Pablo is the director of the Research Institute for Social Equity at the Iberoamericano University in Mexico. Pablo, welcome. Please go ahead and share your screen.
Yes, thank you, Claire, for the invitation and introduction. There it is. Well, I'm Pablo Gaitan from Mexico City. I work at Equide, where we specialize in social policy in Mexico, also in measurement, especially poverty measurement. And we got into studying water basically because we started studying food insecurity in Mexico, and particularly measurement. But since at least 2 years ago, water is becoming a more pressing issue. So we're joining food insecurity with water insecurity in Mexico. And one of the important places where this is happening is Nuevo León, Mexico. So let me talk to you a little bit of what happened in Nuevo León a year ago. First, some context about Nuevo León. This is one of the 32 states in Mexico. This is a high-income state. It's bordered with Texas. And it's an industrial capital in Mexico. It's one of the economic hubs in Mexico. It's mostly urban. And there's a big city that's called Monterrey, which concentrates most of the population in Nuevo León. At the same time, their economic success as an industrial hub has produced some urban sprawl. That means that the city is growing faster than they're able to provide basic services. So there are a lot of new informal settlements from workers coming all around Mexico to work at this factory. So there are many poor places without proper services in their households. One of the links with climate change of what happened in the last year's crisis is that Mexico faced a very large drought. It was shared also in many other places, especially in the United States. But by July 2022, Mexico declared a national emergency due to these droughts. This was covered all around the news, and it struck particularly hard in Nuevo León. Even the New York Times covered the drought. What happened in Nuevo León is that they were running out of water. They didn't have enough water in wells and dams, especially to deliver water in Nuevo León. At the same time, this was something that they were not prepared to face. Years ago, they didn't have these types of droughts, and they were always able to manage with the water they had. So when they faced this important crisis, they didn't have enough infrastructure in houses to face it, particularly with storage. They didn't have tanks in their houses to store water. They didn't have water filters for the water quality, but they were ready from the side of the government to address it. So they didn't have special social programs designed to tackle water insecurity. So this all came by surprise and they had to react fast. At the same time, there was the Health and Nutrition Survey was scheduled to gather data on nationally, but Nuevo León had an over sample from that survey. So we're able to know what was happening using the HY scale on water insecurity. So the national prevalence is 16% in Mexico, but in Nuevo León, it was like 2.5 times higher. And they were facing a 42.6% of water insecurity in Nuevo León. So this is one of the highest prevalences in Mexico. And this number was recorded during the crisis. So let me talk to you about what the way the government responded to this crisis. It was a response that it was actually a first response immediately during the emergency. And the most common strategy in Nuevo León, but also in other places in Mexico, was delivering water to households using these water trucks that you could see in the pictures. So this was very common in Mexico, but this was not a really good solution and people didn't really like it. First, because there was some uncertainty on the schedule. So people had to stay put in their houses and they would have to wait until the truck came. There wasn't a specific schedule for that. And you can imagine how that disrupts their daily lives. Also, they had to do long lines to get the water. And that also spurred some conflict on the water distribution at the spot where they were delivering water. The response was also complemented by giving water tanks for households, especially to improve the storage infrastructure in households. They were also giving these green and orange barrels that you can see in the picture, so they can actually take the water from the trucks to their houses and also store the water at their households. And they were giving carts to carry the water, especially because there were some urban settlements where the trucks couldn't get in. So people had to carry these barrels for some blocks away, and they provided carts to make it easier to do that. They were also concerned about drinking water. So they were distributing water in gallons, in bottles, and even cans. What you're seeing, these are the canned water that Heineken was distributing, and Heineken has a factory in Nuevo León, and they were supporting the government in distributing water also. And lastly, they were giving hygiene kits for people to wash their bodies because there wasn't enough water for washing needs, and they were prioritizing the water use for drinking water. However, during the emergency, they had insufficient supply for all this. So even though the government tried to respond, they didn't have enough for the need for the whole city. And they were prioritizing poor neighborhoods to do that. So they did adapt to the crisis, and especially with their response. And what they did was switching, like as the main response, from the water trucks to community water tanks, as the ones you're looking also at the pictures. What they did is that they selected small areas in most of the poor neighborhoods especially in Monterrey, but in the whole Nuevo León. They also they recruited community leaders in every area. So these community leaders were monitoring these community water tanks. So they were with enough water and in case they needed some maintenance. And they were also kind of helping with the water distribution in every small area. So this improved the way that water was distributed because they didn't have to wait until the truck came, but these water tanks were filled most of the time. And the third component that they implemented was a hotline to communicate between the state government and the community leaders. So this helped to keep the water tanks full and functioning. And they were also able to communicate with the government when any issues arose, and that kind of improved the water distribution in Nuevo León. And they also were increasing storage in the households. So as you could see, these barrels, this is the way they were keeping them in their households. Some of them were distributed by the government, and others were barrels that people were just getting to store water because they didn't know when they will have water and when they would cut it out. And I want to finish this intervention just mentioning some of the pathways that we've looking between water insecurity and mental health. First, there's people are complaining about the uncertainty with water availability. So as I mentioned, the water trucks came, but they didn't know when. So they had to be ready and they had to prioritize waiting for the water trucks, leaving aside other activities. They also had some concerns with water safety. As you could see, they were storing water in their households in any way they could, but they didn't have water filters. So they were concerned about the effects of the quality of water, especially linked with health. They also were telling us about several changes of plans. One that came out a lot is that they had to wash their clothes at midnight, or maybe sometimes like at 3 a.m. because that was the time where it was easy to expect water flowing into their households. Other things that we noticed is that especially women which were in charge mostly to gather water, they also were in charge of policing household rules to save and reuse water. For instance, one of the rules that they had to impose is that no flushing in the bathrooms. So they have to really think when they could flush, and that, as you can expect, that created anger between household members. And for instance, they were telling us about how everyone disliked the odor of urine in household, but they had to endure it because they couldn't flush all the time. Also anger, they were angry about not being able to use water for their plants, and their plants were dying, but they had to keep up with their saving rules inside the household. And finally, one of the things that came out a lot were the water expenses, because even though the government was distributing bottled water for drinking, households, especially poor households, were in need to keep buying water. So they are used to buy bottled water, which is taking a share of their income. So this is like the way they are starting to live, but it is creating some mental health concerns in the households. So I'm going to leave it here, so we can go back to some of these issues afterwards.
Thanks so much, Pablo. Excellent. Really, really interesting to see. So we are going to move on to our second speaker. So Simon Thuo is the Director for the Policy Research and Institutional Development at the Resilience Centre, Nairobi. So I will hand it over to you, Simon.
Okay, thank you very much, Claire. Now, I know it sounds weird, but Pablo's story sounds like paradise. If the people who we have been working with had this kind of problem, water in the house, and then flashing, and they would think they're in paradise. We did a similar survey in Kajiado, which is a county in Kenya, not very far from Nairobi. It's one of the areas you can say that has been affected very badly by the recent drought. This was the worst drought in about 40 years in this region. At the same time, there is critical water scarcity. So the existing facilities, the water infrastructure does not work very well. And what tends to happen is that there is significant delay between when problems occur in the system or in the treatment system and when action is taken. And this delay is often quite deadly because it leads to continued non-functionality and often absolute collapse of the system because they become too expensive to repair. So between March and May last year, I carried out a survey involving 1,512 people to identify, using very simple questions, very simple means, how their house security was. And the result was that almost 70% of the residents are water insecure. And this includes not only the ones who live in areas who often have no infrastructure, but also the ones who live in peri-urban areas, but also some of the richer areas who have to bring in water by truck, and they have to pay a lot of money, up $6 or $7 per cubic meter, which is that's enormously expensive, even for the, you might say, relatively well-off in Kenya. The questions were very simple. Have you been worried about water? How often have you had water interruptions? You could not wash your clothes because there was no water. You had to have a change of plan. Maybe you wanted to go to the market, to go to school, go to somewhere else, and then you had to change that because you had to look for water. You had to eat something different because there wasn't enough water either for cooking the meal you wanted, or the quality of the water was very poor. And it even gets as bad as you could not even wash hands, let alone wash your body that day. And then quite often they had no water to drink. And quite frequently, especially in areas which had pipe systems and they had no water, people are quite angry about that. Many went to bed thirsty. Many had no water at all, and many felt shame about water, especially because it's so much related to dignity and sanitation. And I may remind maybe some of the people who are listening, it has among the worst levels of lack of sanitation. Up to 90% population don't really have any decent sanitation or none at all. There is a lot of open defecation. So for me, the most important lessons from this the exercise was, first of all, simple questions when put clearly can help unearth very complex challenges and problems in the operations and management of the facilities. Second, these simple questions are also quite incisive and help decision makers to understand what the challenges are, and they are able to unmask the hidden poor performance of many of the service providers or utilities who normally say, we have put in so much more new pipe, invested so much more in pumping and systems. So when you see this data, you start to understand that it is not functioning as it should, and no wonder revenue collection and the losses and leakage turn out to be quite frequent. A good thing about this was that some of, especially the ones in policy and the legislative at the county level, were able to understand and were able to
I think we might have lost Simon. Just give him a couple of minutes just to see if he can rejoin. Simon, are you there? Okay, well, hopefully Simon can rejoin in a moment. So I think we will we'll just move on, and I really hope that he can join back in a second. Okay, I think he's just dropped off. So we'll move on to our next speaker. Apologies. So our next speaker is Sandeep Maharaj, who is a senior lecturer in pharmacy at the University of the West Indies. So I will hand over to you, Sandeep. Could you just test that you can share your screen?
I'm all here, I'm all yours, and sorry.
Fantastic.
I'm all here, I'm all yours. Let me get going, and we shall start my presentation. And I wish to thank all the organizers for having us today, and really, for making the effort to have this forward. Disclaimer up front, I'm no water and health expert. I hope my screen is being seen. Oh, sorry about that. But I will speak about some work I did. So I'm Dr. Sandeep Maharaj, Designate Director, School of Pharmacy, and also Senior Lecturer at the University of the West Indies. Besides that, the reason I'm in this field, I'm also the Global Outreach Fellow at the Planetary Health Alliance, Senior Global Outreach Fellow, and have been working in the field of Planetary Health Alliance for the last maybe 6 years. So my project focuses on the Caribbean. And, the Caribbean is a very interesting area. While majority of the world is 2/3 water and 1/3 land, we are slightly a bit less land here in the Caribbean. So water, we have a lot, but usable water, that can really be something that can have impacts on our health and our potential wealth in the Caribbean. What are some of the challenges we face with water in the Caribbean? So approximately 53% of the people live within 100 kilometers of the sea, while 43% live within 10 kilometers of the sea. And that would have come from our historical antecedents, where ports, etc., would have been set up for economic activity and growth. And that's where people earn a living. So they obviously live closer to the sea within the region. And that allows for a number of potential things. A study done in 2019 found that parts of the issues that we face with in the Caribbean with water is that we have poor institutional arrangements where we have lack of institutions working together to ensure that there's fresh water on the table at all points in time for persons. And there is poor data management. So many times we don't even know what is happening in many instances. And that comes from a legacy of colonialization, where many times the hinterlands were really the ones that were in control of our development and so on. And hence we are now in the process of developing our own resilient systems to deal with data management and so on. Poor community engagement and the threat of saltwater intrusion. Now, this is beautiful Mayaro here. If you can see my screen, a fantastic place where I go on a regular basis, and developed a real affinity for the people, very kind, humble, not very wealthy. But I looked at a study that happened in Bangladesh, which was able to show that saltwater intrusion was actually impacting upon the lives of persons in the coastal areas, where there was an increase in hypertensive events among Black population. And they were able to show clearly that the levels of salinity in per liter per water was around 3,000 milligrams per liter, while the norm by and large was around 2,000 milligrams per liter. And that got me interested in working with the community. I also had a project, so both things work together at the same time, to find out what is happening in Mayaro. Because there was a different taste in the water whenever you stayed in Mayaro. And we went about measuring the sodium levels of the water in Mayaro. And we used a control area, which was Sandy Grande versus Mayaro. And we took over 100 samples of water in both areas. And we found in Mayaro, the sodium level was about 50 milligrams higher. Think about 50 milligrams per liter higher per day. Now, we were unable to correlate, because again, our data management systems were not that good, what was the hypertensive state. And really and truly, a study of this nature requires deep, and high level interventions to work through if we can link the hypertension to the level of salinity. So we couldn't make that link, but also did some speaking to the farmers in the area. And besides the sodium water potentially could have an impact on the hypertension, farmers face challenges with actually growing their plants. They said over time, they have found the plants are not growing too well, and they also recognized a change in the water taste. There's also been inconsistent freshwater supply through the normal. They were maybe getting water once a week, maybe sometimes recently as once in 3 months. So what we did, there was little that we could have proven at the time, but we decided to work on potential solutions. So we worked with the local government authority, first of all, to bring awareness of the problem. They were not really aware of the health impacts. It was sort of new news to them. So we were able to let them know it's not only a matter of persons not having access, but it's a problem also of potential health with impacts on their health if this is not managed well. We also work with the Water Authority and inform them of what potentially can happen to get better regular schedules. Unfortunately, it has actually got worse, not better. We worked with the grant agencies to let persons know persons would require tanks, which wasn't something before, and we got that done. So there was water storage, and we was able to really work on the education of healthcare professionals, informing them of the potential threat. And finally, we're able to develop some educational tools for farmers in managing the crops. In about 2 years' time, we intend to see how this has worked, to what extent it has had an impact, and we will see how it goes forward from there. I see a very very harsh stare there from Claire, so I presume I'm touching on time. So thanks very much, Claire, and I move on to our next speaker. Thanks again. Right.
Thanks so much, Sandeep. Yeah, brilliant. So we'll hand back over to Simon. Sorry, you got cut off earlier. So if you can, I just check that you're there. And if you would like to share slides, Simon, please do go ahead and share your screen.
Okay. No, yeah, network is not very good, so
Okay.
I'm just going to continue. So as I was saying, there was pushback from the technical officers who manage the operations and maintenance of these schemes for several reasons. One, it was uncomfortable to have the public having an eye and having a mechanism to report on what was happening on the ground, and which could lead to reprimands from your superiors, particularly the political officers. And it could also be linked to the fact that they have very low budgets to operate, because it's a, you can say it's a kind of systemic problem. The systems are operating poorly, so they collect less revenue, they have less to put back in, and it's a vicious cycle. But on the other hand, it also led to myself being invited to participate and facilitate the development of a new policy and strategic planning framework for the next 5 years, because they found it could be valuable, and it was, you might say, better to incorporate me and the people who I worked with rather than leave us out, because they found that some of the insights that we had through this process were quite useful. And for the first time, they have agreed to put on the on the planning process an effective monitoring and evaluation system, which can provide the kind of faster responses that are required. So yeah, I'll stop there. I hope you are able to follow on the narrative, and if not, I'm quite happy to answer any questions.
Thanks so much, Simon. Excellent. Thanks so much. So we'll come to our final speaker, Natalie Greaves. So Natalie is a lecturer in public health at the University of the West Indies, and has been very active in the Climate Cares project, which focuses on climate change and youth mental health. So I will hand it over to you, Natalie. I'm not sure if you would like to share your screen or not.
Thank you so much, Claire. Thanks for the invitation. I'm not able to share my screen or my video right now, but I'm hopeful that when we get to the question and answer period, I might be able to do so. So just briefly, I just wanted to take the opportunity to speak about a couple studies that we have done in the Caribbean related to climate and mental health, and anecdotal experiences related to water scarcity. So just because the internet connection is a little weak, Claire, can you confirm that you can at least hear my voice right now?
Yeah, I can hear you.
Okay, wonderful. Okay, so as Sandeep would have mapped out, when we are talking about the Caribbean, we are talking about an area that has the English-speaking Caribbean in particular, an area that has a population of about 44 million persons. And in that Caribbean basin, in the English-speaking islands, that's where most of the work has been concentrated. We are facing the existential and real and creeping threats related to the climate crisis. Now, for those of you who might not be familiar with Caribbean sociology, in the context of our contemporary globalization experience, we do suffer a lot from food insecurity and lack of food sovereignty. And in addition to that, there is, especially in the Eastern Archipelago, where Barbados is, many of the islands are water scarce. What that has resulted in a reliance of groundwater that's not necessarily sustainable at all times. And then the advent of desalinization to augment the water supply. What we've noted with the desalinization, augmenting the groundwater supply, is that in the context of the dry weather spells, etc., there's a tremendous amount of pressure on farmers in particular. And this has also been associated or possibly associated with not suicidal clusters or anything like that, but perhaps some mental health strain there. Also, as it relates to the ability to deliver primary health care effectively to regions that are impacted by water scarcity, the ability to care for ill persons in the community is also impacting the mental health and the coping mechanisms of caregivers. So to give a very practical example, you may have a person who may have, for example, a diabetic foot. They may have a cancer or another disease that requires water for the daily use, waters for the activities of daily living and for wound care. And that sometimes can be compounded by the lack of accessible water. One of the studies that we want to highlight, I know you've mentioned climate cares, so I'm going to come to climate cares and connecting climate minds in a bit, was some of the work done related to another island in the, not so much in the Eastern Caribbean, but the Northern Caribbean, an island in the US Virgin Island cluster after Hurricane Maria. We were able to, as part of the disaster response there, to conduct household surveys, a cross-sectional survey that tapped into more than 1,000 households, also analyzing some of that data qualitatively to find out what were some of the stressors that persons were experiencing post-disaster and some of the infrastructural needs. And water featured as a lack of water, I should say, post-disasters featured as a significant source of stress. I think in this audience, many of us are familiar with Maslow's hierarchy of needs and the reversion in the hierarchy of needs that can occur in the context of a disaster. So we're not only talking about the need for water management post-disaster. In this case, it was a tropical cyclone. But persons were talking about the lack of water affecting them as individuals, as humans, but also their animals and the stress that was causing because of the inability to provide water to animals, including pets as well. And as it relates to the Climate Cares project, the Climate Cares project was a cross-sectional survey that did have 4 major subsections that could be analyzed qualitatively, conducted with youth across Guyana, which is in the southernmost part of the Caribbean basin and actually counts as a South American country, Trinidad and Tobago and Barbados. And while water did not feature specifically as a source of stress, we do know that youth are very concerned about their mental health, the stability of the climate. There's a certain level of solastalgia that is occurring in terms of, especially for persons who might be deeply connected and rooted to the land by virtue of their indigenous or First Peoples background. And so I guess in summary, I'm not sure if I've gotten the signal or not, and I'm that everything I said came across. If internet and everything stabilizes, I will be able to at least share slides with participants or give slides that could be used afterwards. What we are saying is baseline, we have underlying problems with water security, but then when we layer on top of that the threats that occur because of the climate crisis, the increasing temperatures, the atypical rainfall patterns, the cyclonic pressures, we are having on top of challenges with water for agriculture, challenges with water for healthcare, we are also having additional challenges that occur when these acute events happen. And it is affecting there is evidence to suggest that it is affecting the mental health of the average person in terms of the average adult, but also it's something that you think about, but I cannot say that based on the climate care issues for you. So I think climate mind is the PI. He's also the PI for climate cares in the Caribbean. So we can both field these questions. Connecting climate minds, I encourage everyone to Google it, to sign up for your geographic region. And we are really trying to unpick in a very robust scientific methodological way the impact of climate on mental health. And because of the baseline work in St. Croix and climate cares, etc., and also narrative scoping review that we are completing, we do know that we need to think about climate and water scarcity and health. Now, finally, just a little bit of work that I've been doing for the last, I would say, week and a half, 2 weeks through some challenges here in Barbados. We've had an increase in suicides. We've just come through a period of tremendous drought, water, rainfall fall off, and heat wave. And during that heat wave, we would have noted an increase. We're not saying that there are not other confounders, but we do know that we have a cluster by virtue of numbers. We usually have a suicide rate of 0.3 per 100,000. In the space of about a 3-week period, we would have had 7 suicides. In addition to that, we would have had suicides by atypical methods for Barbados. So there's a cluster by hanging. This is public domain data. And we do know that lack of rainfall, there's at least one study 2014 in Mexico associating lack of rainfall, heat stress, temperatures with suicides by hanging. So I just think we can't say anything conclusive yet, but I'm just sharing this because globally right now this year in June we recorded the highest temperature ever on the earth. So I think that this may be an opportunity for all of us as scientists to look and see what kind of epidemiological trends might be emerging. And I'm just going to stop there, Claire. I'm really hoping that this information came through. Can you confirm that you were hearing me?
Yes, yeah, we heard that.
Okay, wonderful. Okay, thank you.
Thanks so much, Natalie. Could I suggest putting a link to the Climate Cares project in the Q&A box so that participants can follow the link and have a look at some of the work that you were talking about?
Sure.
Thank you. Yeah, it really sounds like, you really kind of highlighted many different sort of avenues for needed research that, we can see these kind of associations, and there's a lot of anecdotal evidence, but a clear kind of need for research in certain areas. Fantastic. Okay, so now that we've heard from our speakers about the existing evidence around the linkages between climate change, water security, and different forms of public health, including mental health, let's have a kind of deeper dive into the knowledge gaps that exist and talk about potential ways forward for closing these gaps. So Pablo, I'm going to come to you first. So in your expert opinion, what additional evidence is needed to link climate change, water insecurity, and mental health in Mexico and beyond?
Yes, thank you, Claire. I would give my answer like in 3 parts. I think first, regarding measurement, I think that we need more indicators on what's happening around water insecurity. I'm thinking about like coping mechanisms, because we need to be more specific on the pathways, especially like we've been talking a lot about water expenses, storage, quality, and we need to understand what's happening in the households and also how that's interacting with food insecurity. Likewise, I think we need to be more specific on which mental health outcomes are we talking about, because some are using stress, others are using anxiety, and I think that mental health is like a big like umbrella term for we need to be more specific on that. And the same for climate change. I think that we have different types of climate change events, they vary in type and intensity, and even in resources for government responses. So we also need to look at variations on those like climate change events. Also, I'm a bit interested as a researcher a lot of on designs, on what kind of designs could help us give a better answer on that. And I'm worried about doing a better job in identifying intra-household dynamics, especially how are we assessing disproportionate impacts within households, and particularly with a gender focus, because I believe that the impact is greater in women, and we need to be able to acknowledge that. Also, I would advocate for using more pre-post designs following the same individuals, which is like a much more complex panel design. But I would love to use the climate change risks to measure impacts of disasters, and being able to measure it initially using these risk indices, and then looking at what happens where they're facing these climate change events. And also, I think we need better qualitative research to really detail all these pathways. A lot of the information, for instance, that I gave came out from talking to people, and they were telling us exactly what were the links between the event, water insecurity, and then mental health. It's not only models that we need. And lastly, I would say something about we need more detailed data on water insecurity. Especially, we have now some available data at the national and state levels, but we need to go at a lower level to actually see a much more detailed picture of these events. And I would like to have geotag data so we can actually link it to specific events. I think that that's very important to have quality on the data. Thanks.
Thanks, Pablo. Yeah, and I think your the study that you presented with that really stark difference between the national level and the local level prevalence really kind of highlights that, and is a huge kind of advocacy for collecting data at such a higher spatial resolution, so that we have that more detailed information.
Yeah, completely. Yeah.
Fantastic. Okay, I just want to invite any attendees. If you have any questions for the speakers, please do put them in the Q&A, and we will read them out at the end. So if you have any questions, please do pop them in. Excellent. Okay, I'm going to come to you, Simon, next. And so I would like you to talk about what you think the most important climate events that are of most concern in Kenya, and what strategies need to be developed to increase resilience to these specific events.
Okay. As I said, maybe some of you are too young, or maybe you are not born then, but there was one time in 1984, there was We Are the World, when almost 1 million people in Ethiopia died of the famine, the drought. But what is not realized is that in Karamoja in Uganda and in South Sudan, a much greater proportion of the population actually perished as a result of that drought. Now, we had a similar event in the last 4 years in this region. And one of the direct results is wasting and stunting of small children from malnutrition, more than doubles during this period. As families lose up to 70% of their only asset on earth, which is their livestock, then you can expect the kind of stress that is experienced, and anxiety, and violence breaks out. And so the most important measures that we can take is to improve water security through all means. Nature-based storage, great infrastructure, however it can be, we have to capture and store water. One of the aspects I did not give from our study was that the anxiety and prevalence of anger is much higher among the older people, more than 45 years. It's almost 50% higher than in the 15 to 24-year-olds, because they're more facile, they can walk more easily, they can go, they can go and get water from different areas. Another issue, which was kind of interesting, is that we have three kind of regions: urban region, peri-urban regions, which is the slum, informal settlements, and areas which don't have really proper urban infrastructure and rural areas. And the women in the peri-urban areas are the most affected, more than 80% of them, when compared with in the urban areas, about 70, and in the rural areas. So women in these areas, which are the fastest growing part of Africa, are the ones who are most significantly affected by insecurity about water scarcity. So even as we build infrastructure, we have to look at what are the appropriate solutions for many of these what do you call it, households, because they're outside in the rural areas where they have land to depend on themselves. So they are built dependencies because of the kind of lifestyle and livelihoods that they pursue. So I think as a result of the you might say poor performance of in the water utilities, I think the opportunity to stress the need for quick and dirty data that is simply understood is really important. It has much higher value, way beyond just the fact that you are able to collect some information, and that's something I'll look at stressing going forward.
Thanks, Simon. And really interesting that you picked up on you made the point about increased conflict as well, and climate change, and the whole pathway of climate change, water insecurity, and mental health, and the impacts that then has on conflict. I think that's maybe outside of the scope of this webinar, but I mean certainly a really kind of important point to make. So we'll next come to Natalie. I'm just checking that you're still there. Yeah. So Natalie, I wonder if you could, you already sort of talked about it a little bit, but I wonder if you could pick up on what the key knowledge gaps in how climate change impacts mental health. What are the key knowledge gaps, and how can these be filled? So if you can, pick up on a couple of the ones that you mentioned.
So I think I changed location while I was on, so I'm hopeful that everything is better now. But I similar to what I believe it was Pablo was saying, I think it's very important for us as we develop this body of work to think about the nomenclature that we're using. So as we have the opportunity, all of us here, to think through where do we want to see this climate and mental health agenda, how we want to see it progress, I think we need to think about nomenclature. I think also because by agreeing on nomenclature as far as it's possible, we might be able to come up with some case definitions. I think there's still a lot of debate as to whether or not what we're seeing as being natural resilience or natural situational stressors, if these really are mental or elements of mental ill health. And if we might be overreaching when we are saying, eco-anxiety, eco-depression, solastalgia, etc. Are these not really just normal natural responses? But I think that we owe it to ourselves as not just a species, but as humans who are working collectively of the biosphere to agree on what we mean, how we're going to examine it. I think also because the problem is so pervasive in what some people feel comfortable as calling the global south, I think we need to not only think about what we will research, but how we will research it. So for one, I think we need to research definitions, understandings, case definitions, so definitions of key terms, definitions of if we are going to be labeling something as a pathology. I think also we need to agree on the ways in which we can build community resilience. I think that needs to be a big focus of research. Not only mechanisms for what are the areas of resilience, but also what do people want to be resilient in. I think out of respect, we have to let persons who we may think need to be more resilient determine the level of resilience that they feel comfortable with achieving. And then in addition to thinking about resilience research, the monitoring and evaluation research that needs to go along with that. So I think in this, I'm not an implementation scientist, but the more and more I get into this field, I feel like we need to take an interdisciplinary approach that will take into consideration implementation research. I think we also need to maybe, as natural scientists, public health specialists speak more to our economic colleagues in terms of the work that looks at the economic impact of climate, water scarcity issues and mental health issues on farming output, maybe disability adjusted life years. That kind of work I think needs to be done as well. And because I have a distinct bias for qualitative research, I think because the field is evolving, qualitative research must have a place, because we can't do the quantitative work to test the hypothesis unless we generate the hypothesis in the first place. And I think that now that, especially with the new AI technologies, there are lots of ways that we can incorporate qualitative work into our quantitative studies to develop some really rich mixed method studies that can go in either in sequence or in parallel. And I cannot see you because I'm not wearing my glasses, but at least I know that you're hearing me and you're seeing me. Yeah.
Thanks,
Did that
Natalie.
help? Did that help?
Yeah,
Yes.
perfect.
Okay,
Thank
great.
you so much.
Wonderful. Okay, great.
And then finally, I was just going to move on to talking about stakeholders and engaging with stakeholders. So I wonder, Sandeep, if you could give your thoughts on who the stakeholders are that we need to engage, you know, in this quest to reduce climate impacts on mental health, and what lessons we have already learned from your previous work with engaging stakeholders. Thanks.
Oh, yes. So here we go. You asked me, so I'm going to sum it up in less than 5 minutes, less than 2 minutes. So what we have been doing is trying to build a living lab within the Caribbean, getting private actors involved, users, public actors, and knowledge institutes. And that's important because I'll skip this. That will take me a day. But what we need to understand is really and truly, where does the Caribbean come from? And many times we lose that perspective. We came from, and it's a real justice issue, where we were used and utilized to fund the Industrial Revolution. And this is well documented by Dr. Eric Williams in Colonialization and Slavery. And today we are feeling the impacts of the Industrial Revolution, which has led to anthropogenic change. It is real, and we feel it here within the Caribbean. But we can't throw our hands up in the air. So where do we go? Well, we first did the survey in the Caribbean, looking at the youths and the impact on mental health, which took into consideration Trinidad, Guyana, Suriname, Trinidad, Guyana, Barbados. And what we found out of this first climate care survey, about 45% of the persons actually self-reported a lifetime history of mental health conditions. And the perceived stress index, the median was 8, and we found also the median to be 55 when I looked to moderate life satisfaction. So we can't leave that there. It was very consistent with UNICEF study in 2021. So what we have then done, we have engaged with Imperial and the global dialogues that are currently taken, that is taking a youth perspective, a lived experience perspective, expert stakeholders perspective, and UWI is very much involved in developing this research agenda going forward. And this here is the groupings that are involved in that research agenda. But how do we create change? How do we create meaningful change in the Caribbean? And this is what you're asking, who do we get involved? So right now, I am around and we are working. We are right now looking to do the knowledge generation and translation, doing country-based studies in the Caribbean, national and regional transformational workshop for healthcare professionals, and at the end of the day, national and regional stakeholder dialogues, and developing a very robust communication plan to go with that, all informed from the research that is going to take place. To have that, we are looking to do 2 ethnographic studies in countries that have been, one that has been impacted by climate change, Dominica, and Trinidad and Tobago, which is not impacted by climate change, hurricanes as much. And from that, obviously now you have opened my eyes. Water is something that will have to play an important role there. And coming out of those studies and so on, we intend to have youth education, resilience, professional capacity building, political sensitization, advocacy, and finally, public sensitization and advocacy. And knowing that the Caribbean is a place that we have music, everybody knows that we are famous for our music. We intend to engage them in a big way, those stakeholders, to make that meaningful change. So in a few minutes, I hope I have captured what the pathway is forward for us.
Thank you so much, Sandeep. Thank you. So we just have a few minutes left. So I think what I would like, I don't think we have any unanswered questions in the Q&A. So what I would really like is for each of the speakers to just give a kind of final thought, a final reflection, and maybe addressing what you see as your single most important key development needed for a step change in the area of climate change, water insecurity, and mental health. I'll open it up if anybody would like to volunteer to go first. Pablo, would you like to go?
Yeah, sure. It's a hard one to single out one thing, but I would stress the research designs. I mean, I know it's a very academic response, but I think that we need longitudinal designs to actually pin down the pathways, and that would give us a really good answer and a way to start addressing this. And yeah, I would keep that one.
Perfect, thank you. Simon?
Yes, for me, I think having looked and understood and really appreciated the utility of the IY scales, one of the best things we could do is to see how applicable it would be not only to drinking water, but also to other forms of water use, because in our region, we have a lot of issues around water for livestock, water for other purposes, and also looking at how it can be used to look at the performance of other essential services, other essential services related to water resources. And secondly is the methodology for expedite response, I think, is very, very robust, and that is also another concept that we can look. I mean, would be very useful to look at how it can be extended as well. And just to give a bit of motivation, you might have heard that between 30 and 50% of most water service infrastructure in Africa is non-functional, and it's exactly because of the long-term delayed responses to the challenges that could have been addressed quite quickly if we had taken more seriously this kind of approach.
Thanks, Simon. Sandeep?
Hi, I just want to say that, we are going into a situation where by 2030, we expect, or 2050, sorry, to have 10 billion people walking around. So we're going to increase significantly, approximately by 40%. So with that, the need for water is going to increase definitely. And 2/3 of what we have around us is water. How we can innovate, recreate, and develop new systems to improve our access to water is what will actually determine a number of the factors that you talk about. Once we have that, it will then reduce the mental stress, it will reduce it. So believe it or not, we need to measure a lot of these things, but the solutions not necessarily are in our hands. But the only way solutions will be developed is if we can actually identify the problem that is there clearly and ensure that the problem is well articulated out there in layman's terms. Thanks.
Great, thank you. And finally, Natalie.
I think the most important thing from my perspective is to engage in this work fully from a qualitative perspective. Seeing that it's an emerging field, I think we should take the opportunity to go back and address some fundamental things, things that we may be taking for granted. So definitions of water, understanding how people relate to water, how they use it, how they prioritize it, how they feel when they don't have it around. Understanding from them what they think needs to be implemented, and more importantly, how and how soon and with what mechanisms. So I think a major push for me would be the incorporation of qualitative research into whatever we're doing.
Thanks so much. And just a final kind of thought to build on what you just said, Natalie. I think that's a huge kind of plea for more HYs and IYs, so the water insecurity experiences scale to be implemented in the Caribbean as well. Fantastic. Okay, so we have come to the end. Thank you all so much for joining, and thank you to our really fantastic speakers and organizers as well. This has been very insightful, and it's been an absolute pleasure to have you all here to talk more about this this area of research. And I hope that we can continue to work in this area, and we will obviously disseminate anything that comes out of this this webinar series to all of the participants as well. So thank you so much for joining.
Thanks.
Thank you. You're
Thank
welcome.
you. Bye.
Thanks. Bye.
Thank you.
Thanks, everyone.
Thank-